Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. The Honorable Director of Universitas Andalas, who in this occasion is represented by the distinguished Vice Rector II, Dr. Hefrizal Handra M.Sos SC. The Honorable Expert Staff of the Governor for the Economy and Finance, Mr. Saiful Bahri SPMM. The Honorable the National Agencies for Disaster Countermeasures of West Sumatra, who in these occasions is represented by Mr. Henry Zulfiton STMT. The Honorable Rector of Universitas Alifa Padang, Dr. Fani Ayudia M. Biomed. And we would like to recognize Head of M. Jamil Hospital, Dr. Dovi Janas SPOGK. And the Honorable Deans of the Faculties of Nursing of Universitas Andalas, Dr. N.S. Deswita SKP MCAP SP CAP AN. The Honorable Head of Padang Health Office, Dr. Sri Kurniayati. The Honorable Head of PPNI Padang, N.S. Haji Alfitri SCAP MCAP SPMB. And Head of the Committee of the 5th Andalas International Nursing Conference, N.S. Yanti Puspitasari MCAP PhD. And we also respectfully acknowledge the partners of collaborators of the 5th Andalas International Nursing Conference, Director of PT Abscaps Indonesia, N.S. Yaumil Fajri Escap, and Director Career Indonesia, who is represented by Ms. Inka Selvia. And we would like to recognize our speakers for our today's event. First is Mr. Fauzan Aziman STMN PhD as a Director of General of Research and Development, Ministry of Higher Education, Science and Technology Indonesia, Associate Professor Craig Logur RN BN Gradip MNSC PhD from the Joanna Briggs Institute Australia, Professor Yu Yun Chu PhD RN FAAN National Changkung University Taiwan, Professor Hiba Wehbe Alama PhD from University of Michigan Flint, USA, Associate Professor Dr. Kamsunapat Baltip from Prince of Songkla Universities of Thailand, and Professor Nelwati SKP MN PhD from Universitas Andalas, Indonesia. And also distinguished leaders, lecturers, participants, and students who attend our agendas today. Ladies and gentlemen, on behalf of the organizing committee, we extend a warm welcome to all distinguished guests, esteemed speakers, and participants and delegates joining us for the 5th Andalas International Nursing Conference 2025. We are thrilled to host these gatherings of bright minds dedicated to advancing healthcare through research and technology. This conference is organized by the Faculty of Nursing of Universitas Andalas in collaboration with various prominent institutions such as Universitas Gadjah Mada, Prince of Songkla University of Thailand, National Changkung Universities of Taiwan, and Universitas Alifa Padang. And also, this conference is also supported by our partners, Abscaps Indonesia, Kero Indonesia, Aswa Padang, Kyoto Gaku, Java Medica, Wardah, and Azwa. Ladies and gentlemen, every year, the 5th Andalas International Nursing Conference in 2025 held in West Sumatra, where we see a lot of cultures, especially in dancing. Tari Pasambahan is a traditional dance of West Sumatra that embodies the spirit of hospitality. This graceful is a visual representation of warmth and welcoming natures of Minangkabau people. Ladies and gentlemen, please welcome Tari Pasambahan by Sanggar Tari Sofiani. Ladies and gentlemen, we will begin the program by the singing Indonesia National Anthem Indonesia Raya. To all audience, please stand up. To all audience, please be seated. Ladies and gentlemen, let's hear speech by the heads of the committees of the 5th INIC 2025. Ladies and gentlemen, please welcome NS Yanti Puspitasari, MCAP, PhD.
Tes. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning and warm greetings to everyone. All praise be to Allah subhanahu wa ta'ala, the most gracious, the most graceful, who will bestow us with health, strength, and the opportunity together in this meaningful scientific forum. My blessing be upon our beloved Prophet Muhammad Sallallahu Alaihi Wasallam, whose teaching continue to inspire compassion, knowledge, and heart service to humanity. Distinguished Director of Research and Development, Ministry of Higher Education, Science and Technology, Republic of Indonesia, Mr. Fauzan Aziman, PhD, the Governor of West Sumatra, represented by Governor Expert Staff for Economic and Financial Affairs, Mr. Saiful Bahri, SP, MP. Director of Andalas University, represented by Vice Rector 2, Ms. Dr. APT Hafrizal Handra, SC. The LPPM Universitas Andalas, represented by Vice Head of FPPMs, Dr. APT Raidi Ismet, and our Deans, Dr. Deswita, MCAP, SPCAP, and Vice Dean, and representative leader of the Faculty of Nursing, Andalas University. Our distinguished keynote and plenary speaker, Honorable Guest, Director of M. Jamil Padang, Dr. Jovi Jonas, SPOGK, Director of RS UNAND Hospital, represented by Dr. Yose Ramda Ilhamdi, Head of Health Barrio of Padang, represented by Dr. Aklima MPH, Alumni Organization represented by Dr. Nurse Surya Effendi, Director of APSCAS by Nurse Yaumil Fajri, Indonesian National Nurse Association of Padang City, Nurse Haji Alfitri, PhD, and Rector Alifah, Dr. Fani Ayudia M. Biomid, and Disaster and Fast Response Unit BPPD of Bapak Henry Zul Piton. It is with the great excitement and gratitude that we welcome you all to this biennial event, the fifth Andalas International Nursing Conference 20 and 25, proudly hosted by Faculty of Nursing, Andalas University. INIC deserves a fiber from the scholar, healthcare professional, and students from around the globe to engage in meaningful dialogue, share innovation, and strengthen collaboration in health sector. This year, we honored collaborate with our esteemed co-hosts, Prince of Songkla University, National Cengkung University, Universitas Gajah Mada, and Universitas Alifah. We also delighted to welcome over 300 participants, both offline and online, to attend this INIC this year from India, Thailand, Malaysia, and Indonesia. It's reflecting that international spirit and also growing network of INIC. Our theme this year is empowering professional healthcare for global health impacts, innovation in education, resilient and sustainable practice in future challenge. Remind us to urgent need to transform the healthcare education and practice to meet the evolving challenge of our times, from pandemic to climate change and beyond. On the highlight of this year's conference is participation of Joanna Brick Institute GBI. We are deeply honored to welcome Associate Professor Craig Lockwood, Director of Implementation Science, GBI, Adelaide University, Australia, as one of our keynote speakers. His expertise in translating evidence into practice will inspire us to bridge the gap between the research and also clinical impacts. Our conference begins with a special workshop led by GBI expert, and now following by international conference session during the keynote and plenary speaker, and also 74 oral presentation covering the various nursing disciplines like clinical and advanced nursing, maternal and pediatric nursing, psychiatric and community nursing, and also management and leadership. We are equally privileged to host other distinguished speaker, Professor Hiba Wehbe Alama from University of Michigan, Fins, USA, expert in transcultural nursing. The Professor Yu Yun Elishu from National Cengkung University will have expertise in digital health and multidisciplinary research. The Associate Professor Kar Sunapat Balti from Prince of Songkla University, Thailand, will focusing on community engagement. And then Professor Nelwati from Andalas University will share her insights on peer learning and nursing education. Ladies and gentlemen, this conference would not be possible without the incredible teamwork, dedication, and also commitment of our organizing committee. And then I would like to express my deepest appreciation to every committee member that their hard work, smart work, and unwavering dedication that make this conference is possible. And finally, I would like to thank all participants, guests, who have joined us here today. Let this conference be not only to share a knowledge, but also the platform to build a collaboration and also the long-lasting friendship. And then, once again, welcome to INIC 20 and 25, where evidence meet action. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Distinguished guests, ladies and gentlemen, let's hear a welcoming speech by the Deans of the Faculties of Nursing of Universitas Andalas. Ladies and gentlemen, please welcome Dr. N.S. Deswita, SKP, MCAP, SPCAP, AN. The floor is yours.
Bismillah, Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. Alhamdulillah, Allahumma shalli ala sayyidina Muhammad wa ala ali sayyidina Muhammad. Distinguished guests, colleagues, and friends, on behalf Minister of Higher Education, Science and Technology, Fauzan Azima, ST, Main PhD. On behalf the Governor West Sumatra, Pak Saiful Bahri, SP, MM. On behalf the Rector of Universitas Andalas, Dr. Hafrizal Handra. On behalf the Head of the West Sumatra Provincial Health Office, Pak Saiful Jamal, SKM, MSI. On behalf the Director of RSJ, Profesor FB Saanin, Bapak Surya Effendi. On behalf the Director of RSUP, Dr. Jamil, mana ya Bapaknya? Dr. SUPM Jamil, Dr. Dovi Janas SPOG, Subs FKM Mars Fiskua. The Chair of PPNI Padang, Dr. Nas Alfitri MCAP, SPKM MB. On behalf the Head of BPBD, Bapak Henry Zulfitra. The Director of APSCAP, Nas Yomil Fajri. On behalf the Director of Care Indonesia, the Head of RRI Padang, Bapak Santoso A. SSN. On behalf the Chair of LPPM Universitas Andalas, Dr. APT Friadi. The Rector of Universitas Alifah Padang, Dr. Fani Ayudia M. Biomed. Our Vice Deans and the entire academic community of Faculty of Nursing, Universitas Andalas. Esteemed speakers, partners, sponsor, media college, and participants from across Indonesia and from Malaysia, Thailand, Taiwan, India, Nigeria, Pakistan. Welcome to the 5th Andalas International Nursing Conference, INIC 2025, with theme Empowering Professional Healthcare for Global Health Impact, Innovation in Education, Resilience, and Sustainable Practice for Future Challenge. On behalf of Universitas Andalas, it is a privilege to open the 5th INIC 2025. We are honored by the presence of our distinguished speakers. Associate Professor Craig Lockwood, the University of Adelaide, Australia. Professor Hibah Wehbe Alamah, University of Michigan, Flint, USA. Professor Yuyun Alice Su, National Cheng Kung University, Taiwan. Associate Professor Kasunapat Baltip, Prince of Songkhla University, Thailand. And Professor Nelwati, Universitas Andalas, Indonesia. We also thank our co-hosts whose academic partnership strengthen the scientific and educational reach of the conference. National Cheng Kung University, Prince of Songkhla University, Universitas Gadjah Mada, and Universitas Alifah. Our theme calls for practical leadership on 3 fronts: innovation in education, system and workforce resilience, and sustainable practice that endure under uncertainty. Around the world, health systems are facing converging pressure, aging population, non-communicable and infectious disease burdens, antimicrobial resistance, climate and disaster-related disruption, persistent inequities, and rapid technological change. For nursing and allied profession, this pressure translates into urgent question. How do we redesign curricula for competence and evidence synthesis, digital literacy, and interprofessional teamwork? How do we protect and retain a fatigued workforce while expanding scope and autonomy safely? And how do we embed sustainability, clinical, organizational, financial, and environmental, so that quality improvement persists beyond project cycles? West Sumatra provides a timely context for this conversation. Padang is a coastal, culturally rich, and disaster-aware city. Here, innovation is not an abstract aspiration, it is a necessity. We aim to foreground solutions that are scalable, context-sensitive, and data-driven from structured education programs that improve patient self-management to community-based preparedness that bridges public health, primary care, and hospital system, from digital decision support that elevates frontline judgment to green and lean process improvement that reduce waste without compromising safety. We are encouraged rigorous dialogues across method, random evaluations, implementation science, health economic, qualitative inquiry, because robust evidence and reflective practice must work together. This year's INIC gather a broad and vibrant community, online and offline participants, including workshop participant and oral presenter. Your diversity of disciplines, institutions, and countries is our greatest asset. We invite you to challenge assumptions, share failures as candidly as successes, and co-create intervention that can be transferred across settings with fidelity on compassion. Allow me to express our appreciation to our sponsor, Kyoto Gaku Java Medica, Wardah, and Azwa Parfum for investing in education and professional excellence, and to our media partner, Upscape, Careu Indonesia, and Smart Emergency for amplifying knowledge beyond the conference halls. Your support enables wider access and enduring impact. To our international and national guests, selamat datang. Welcome to Padang, West Sumatra. I invite each you to engage fully, ask demanding questions, connect across disciplines, and live with at least 3 concrete actions. First, you can implement immediately. Second, you can test within your institution this quarter. And lastly, you can champion with partner over the coming year. Let INIC 2025 be remembered not only for excellent talks, but for commitments that translate into safer clinics, stronger teams, and healthier communities. May our deliberation be rigorous, our collaboration generous, and our outcomes impactful locally in West Sumatra and globally across the system we serve. Thank you. Wabillahi taufiq wal hidayah. Assalamualaikum warahmatullahi wabarakatuh.
Ladies and gentlemen, let's hear speech by the Governor of West Sumatra, and who in this occasion is represented by expert staff to the Governor for Economy and Finance. And please welcome Mr. Saiful Bahri, SPMM. The floor is yours.
Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillahirabbil alamin wassalatu wassalamu ala asrafil anbiya wa mursalin wa ala alihi washabbihi ajmain. Asyhadu an la ilaha illallah wa asyhadu anna Muhammadar Rasulullah. Allahumma shalli ala Muhammad wa ala ali Muhammad. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qauli. Pertama, kami menyampaikan permohonan maaf dari Bapak Gubernur, karena Bapak Gubernur sekarang ini sedang bersama Presiden, yaitu pembahasan tentang ESDM. Karena program Presiden cuma 2. Satu ketahanan pangan, yang kedua adalah ketahanan energi. Nah ini untuk pembahasan ketahanan energi dengan Presiden. Kemudian setelah itu beliau dengan Menteri Pertanian membahas tentang ketahanan pangan untuk Sumatera Barat. Yang sama kita hormati Wamen Pendidikan Tinggi dan Teknologi Bapak Prof. Dr. Fauzan MPD. Nanti datang ya? Ya jam 11, oke. Bapak Rektor Eva Yunadi atau diwakili oleh PR berapa Pak? Per 2. Ya, terima kasih Pak. Tadi kami sudah ngomong dengan Bapak Pembantu Rektor, luar biasa. Bapak ini ahlinya matematika. Luar biasa itu Pak, kalau saya pribadi mengucapkan luar biasa. Kemudian Ketua Lembaga Penelitian dan Pengabdian Masyarakat, UNAND Profesor Dr. Teh Marzuki. Dekan Fakultas Keperawatan, Ibu Deswita, ini teman kami sebenarnya. Kita sudah sering bincang-bincang tentang keperawatan juga. Kemudian Wakil Dekan 1, Wakil Dekan 2, Kadinkes Provinsi sekarang diwakili karena Dr. Aklima sedang ada acara peresmian Rumah Sakit Mata Sumatera Barat. Ini baru nih Bu. Ya. Kadinkes Kota Sri Kurniayati, Direktur SUP M Jamil, Dr. Dovi Janas, kemudian Direktur SJ Habisanin diwakili, dan yang paling mulia itu adalah para pemateri kita, speakers kita, Profesor Craig Lockwood. Terima kasih. Thank you for your being here. Give us the knowledge and experiences for us. Thank you. Profesor Hiba WHB Alamah. Kemudian Profesor Yun Alis HSU. Thank you, Madam. Profesor Kasunapat. Oh iya, terima kasih. Thank you. Profesor Nelwati, terima kasih banyak atas materi hari ini. Jadi izinkan kami membacakan sambutan dari Bapak Gubernur. Mungkin bisa bahasa Indonesia atau bahasa Inggris. Tadi saya sudah terjemahkan ke bahasa Inggris. Dia bahasa Indonesia tapi saya terjemahkan ke bahasa Inggris. Saya bacakan aja lah dikit ya. First and foremost, let us express you a gratitude to God Almighty for the opportunity to gather here today in good health and spirit. The theme we bring today, empowering professional healthcare for global impact, is not just timely but essentially. In this era, globalization, rapid technological advancement, and shifting global health dynamics, we are facing increasingly complex healthcare challenges, from emerging infectious disease, global health emergency like pandemics, to persistent inequality in access. In this era, from emerging infection disease, global health emergencies like pandemics, to persistent inequality in access to care, our demands solution about the bold, collaborative, and sustainable. And at the heart of every solution lies one crucial element: our healthcare professionals. They are not just workers. They are the frontline defenders, the advocates, the healers, the educators, and the leaders in health. So, what does empowerment truly mean in this context? Empowering healthcare professionals is not just merely about training or clinical skill enhancement. It goes much deeper. It means ensuring access to continuous education and lifelong learning, so they remain at the forefront of medical innovation and knowledge. Recognizing and valuing their contribution fairly through supportive policies, decent compensation, safe working environment, and professional respect. 3. Fostering collaboration across countries, disciplines, and sectors to enable shared learning and global health solutions that are scalable and inclusive. 4. Nurturing leadership within the healthcare profession, so the professionals are not only implementers, but also decision makers. Ladies and gentlemen, when we empower one healthcare professionals, we uplift hundreds, sometimes thousands of lives. Now imagine empowering thousands of healthcare professionals worldwide. We are not just improving care, we are shaping a healthier, more equitable future for humanity. This is our collective call to action. Government, academic institutions, professional organizations, NGOs, and the private sector. All of us have a role in building an ecosystem where healthcare workers are equipped, respected, and empowered to make global impact. Let me leave you with a thought. Employing professionals healthcare is not just about creating by professional. It's about creating a better life, a better world. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Distinguished guests, ladies and gentlemen, let's hear a welcoming remarks by Rector of Universitas Andalas, who on these occasions is represented by the distinguished Vice Rector too. Ladies and gentlemen, please give a warm welcome to Dr. Hafrizal Handra, MSOS SC.
Dari sini ya. Bismillah. Assalamualaikum warahmatullahi wabarakatuh. Very good morning to all of you, distinguished guests, colleagues and friends. First of all, I would like to welcome our speakers, especially the keynote speaker of this conference ya. Yang kami hormati Pak Gubernur yang diwakili oleh staf ahli. And then on behalf of Universitas Andalas, I would like to welcome and honor our keynote speaker from various countries in the world. The first is Professor Craig Lookwood from the University of Adelaide, Australia. Yeah. Welcome to Padang, and maybe we hope that you also have a chance to come to our university, Universitas Andalas, Green Campus. Yeah. Also welcome to Professor Yu Yun Alice Hu from National Cheng Kung University, Taiwan. Also welcome to Associate Professor Kasunapat Baltip, Prince of Songkla University, Prince of Sokla University is one of our partners through IMT-GT University Network. So in Asian countries, we have a network, especially IMT-GT network, and Prince Sokla is one of our partners. Professor Nelwati from Universitasandalas. And also, maybe we'll attend through online, Professor Hiba WB Alamah from University of Michigan, Flint, United States of America. And also, I would like to express my welcome, respected guests for today. Maybe the representative of the head of West Sumatra Provincial Health Office, Ibu Kepala Dinas. Also head of Health Office Kota Padang, Director of Rumah Sakit Jiwa, Profesor Habib Sa'anin, Director of M. Jamil, maybe represented here, and also the Director of our Andalas University Hospital, Pak Dr. Ahmad Fani, and also Director of Universitas Alifah Padang, Dr. Fani Ayudia. So first of all, I would like to send apology to all of you from our rector, because at the moment the rector is in Tokyo, for a part of our program, with the Ministry of Education, with Ministry of Higher Education, Science and Technology. And also today there will be a keynote speech from our ministry, which is Professor Fauzan Aziman, the Director General of Research and Development. We also thanks to our co-hosts whose academic partnership strengthen the scientific and educational reach of this conference. National Cheng Kung University, Taiwan, Prince of Songkla University, Thailand, Universitas Gajah Mada, and Universitas Alifah, Padang. Today, as we gather under the theme Empowering Professional Healthcare for Global Health Impact, Innovation in Education, Resilience and Sustainable Practices for Future Challenge, we reaffirm our shared commitment to advancing healthcare that is both scientifically rigorous and socially responsive. This conference is more than an academic meeting. It is a platform for collaboration where innovation meets compassion, where research meets real-world challenge, and where education becomes a force for global well-being. Healthcare across the world are undergoing profound transformation. The interplay of democratic shift, emerging disease, climate change, and digital disruption compels us to reimagine the role of healthcare professionals, especially nurses, who stand at the very heart of patient care. As educators and practitioners, we must nurture not only technical competence, but also ethical wisdom, empathy, and adaptability. Universitas Andalas is one of the state university in Indonesia. It's committed to contributing to this transformation through our Faculty of Nursing, especially, and its international partner. We continue to foster evidence-based education, community-centered research, and cross-border collaboration that advance both academic excellence and societal impact. So at the moment, for your information, Universitas Andalas have 4 faculty in health sector, which is the Faculty of Nursing, the Faculty of Medicine, Faculty of Public Health, and the Faculty of Dentistry. So we actually already gathering, having education in all health sectors. So today, the Faculty of Nursing will organizing the important event, and we hope that this event will going very successful and with various professional and also very important academic for today's occasion. Ladies and gentlemen, let this conference serve as a moment of reflection and renewal to question assumptions, to learn from one another, and to craft sustainable solutions that will make our healthcare system stronger and more human. May your discussion bring forth ideas and not only improve professional practice, but also enhance the health and dignity of communities across the globe. Once again, on behalf of Universitas Andalas, I welcome you all to Padang, especially, the land of culture, warmth, and resilience. And also, of course, welcome to Universitas Andalas. Although this conference is not at the university because of the limitation of our facilities, we hope that maybe at the end of this conference, you can go to our campus to see the green campus of Universitas Andalas. May this gathering spark enduring friendships, meaningful collaboration, and impactful innovation that will resonate far beyond this fall. May our time together be fruitful, inspiring, and transformative. Thank you and welcome to Universitas Andalas, Padang, West Sumatra, Indonesia. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. To our Vice Rector, we kindly request you to remain to the stage for a moment. And to officially open our event this morning, we will invite the Vice Rectors, expert staff to the Governor for Economy and Finance, the Deans of the Faculties of Nursing, our speakers, Associate Professor Craig Lockwood, RN, BN Creative, MNSC, PhD, Professor Yu Yun Su, PhD, RN, FAAN, Associate Professor Dr. Kamsunapat Baltip, and Professor Nelwati, SKP, MN, PhD, come to the stage, and the heads of INIC 2025 to the stage to together strike the gong and talempong as the symbolic signs of the officially opened Andalas International Nursing Conference 2025. All right, everyone already have the talempong and the gongs, everyone. All right, so make sure you have one. All right, in my countdown. Okay, in my countdown, 3, 2, 1. The 5th Andalas International Nursing Conference 2025 has been officially opened. All right, next, photo sessions first for our Vice Rectors, speakers, and also the distinguished speakers. Alright, formal. 1, 2, 3. Again, 1, 2, 3. Okay, Minangkabau. Yeah, this is the signs of Minang, rumah gadang. Okay, 1, 2, 3. 1, 2, 3. Okay, next is Universitas Andalas. You can use like logo UNAND. We call that UNAND signs. Okay, 1, 2, 3. Again, 1, 2, 3. Okay, thank you so much, everyone. Directors, head of the West Sumatra, and the deans of the faculties of nursing, speakers, and the head of INIC 2025. Please be seated. All right, ladies and gentlemen. All right, ladies and gentlemen, to ensure our activities today are blessed and run smoothly, let us pray together, which will be led by Sabria Sukra. To Mr. Sukra, the floor is yours.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen, distinguished guests, honorable speaker, and dear participant. Before we begin, let us take a moment of reflection and gratitude. A'udzubillahi minasyaitonirrajim. Bismillahirrahmanirrahim. Almighty God, we thank you for this wonderful opportunity to gather here today for the 5th Andalas International Nursing Conference. We are grateful for the safe journey of every participant and for the spirit of learning, collaboration, and innovation that unites us. We ask for your guidance and blessing upon this event. May every session be filled with inspiration, knowledge, and meaningful discussion. Grant wisdom to our speaker, enthusiasm to our participant, and success to entire conference committee. May this conference strengthen our commitment to advancing nursing education, research, and practice for the betterment of global health. We entrust the 5th Andalas International Nursing Conference into your gracious hands. May all that we do today bring goodness, learning, and unity to all. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina azabannar. Subhana rabbika rabbil izzati amma yasifun wa salamun ala mursalin walhamdulillahirabbil alamin. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Alright, distinguished guests, ladies and gentlemen, we will proceed with our group photo sessions for all participants. And we kindly invite everyone to please stand up. For this photo, we will remain in our respective place, and our photographer will capture the moment from the stage. Alright, for the first formal, make sure everyone to the front row, all the committee to the front row. Oh, right. Maybe we can move on. Formal 1, 1, 2, 3. 1, 2, 3. Okay. Using Minangkabau? Rumah Gadang. Okay, 1, 2, 3. 1, 2, 3. Okay, Universitas Andalas or UNAND? Alright, 1, 2, 3. 1, 2, 3. Thank you so much, everyone. Please be seated. Alright, ladies and gentlemen, before we start our keynote speaker sessions, let's see a performance of Tari Piring. Tari Piring is a traditional dance of West Sumatra, known for its energetic movement and the use of blades as a primary props. This dance symbolizes the gratitude of Minangkabau peoples for abundant harvest, and is often performed in various traditional ceremonies and celebrations as a form of entertainment and cultural preservations. Dancers gracefully swing blades on their palms, creating sounds that accompany the rhythms of talempong and salo music. Ladies and gentlemen, please welcome Tari Piring by Sanggar Tari Sofiani. presenting by Sanggartari Sofiani. Give a warm of applause, everyone. Well, ladies and gentlemen, that concludes the opening series of the events of the 5th Andalas International Nursing Conference 2025. Thank you so much for the participations of our opening ceremonies. And right now, we will now proceed with today's agenda, moving on the keynote speech sessions from our distinguished speakers who is present with us today. And ladies and gentlemen, we will now move into our highly anticipated keynote sessions. And it is a profound honor to introduce our first keynote speakers. And our first keynote speaker is a world-renowned expert from Australia, Associate Professor Craig Lockwood, RN, BN Graduates, MNSC, PhD, the Directors of Implementation Science at Joanna Briggs Institute. And these sessions will be moderated by NS Mahathir, MCAP SPCom. And please give a warm welcome and applause to Mr. Mahathir.
Okay, now we are move on to the fun session, right? So many dancing and also speeches. So I hope you enjoy today's conference. So good morning, ladies and gentlemen. It is my great pleasure to welcome you all to this plenary session. Okay, it feels like there is an earthquake in here. Okay, let me set up the stage first, and then I can start the session. Okay, I think it's finished. Yes? Okay. Let me repeat my welcome greetings. Good morning, ladies and gentlemen. It is my great pleasure to welcome you all to this plenary session. Today, we are truly honored to have with us Associate Professor Craig Lockwood, a highly respected leader in the field of implementation science. Dr. Lockwood is the Associate Professor of Implementation Science at the University of Adelaide, Faculty of Health Sciences. and also serves as adjunct associate professor at Queen's School of Nursing in Kingston, Ontario, Canada. He is widely recognized for his leadership as Director of Implementation Science at Joanna Briggs Institute, JBI, where he oversees global dissemination strategies and tools that support the integration of evidence into healthcare practice. Tools that are currently utilized by more than 9,000 health services worldwide. He also serves as a chair of the JBI Qualitative Synthesis Methods Group, lead of the Cochrane Nursing Care Field, and co-chair of the Cochrane Council, among other significant roles. His scholarly contribution in evidence implementation and qualitative synthesis have had profound impact, and on the way research evidence is translated into real-world clinical practices. Dr. Lockwood is also editor-in-chief of JBI Evidence Implementation and BMC Systematic Reviews, and serves on several editorial boards of international journals. Today's session invites us to reflect on how evidence-based nursing continues to evolve in the era of implementation science and knowledge translation. As healthcare workforces, we are not only consumers of the evidence, we are also the bridge that brings the research to life in the clinical setting. Ladies and gentlemen, please join me in welcoming Dr. Craig. Please welcome Dr. Craig.
Up a long way. Good morning, everyone. I'm going to start my timer. That dance is a very tough act to follow. I feel a little bit intimidated trying to capture some of the creative energy in the room because of the amazing cultural spectacular that we have seen this morning already. But I will do my absolute best for you today. Let me start by acknowledging the honoured guests, esteemed members of government and ministry, members and leadership of the Faculty of Nursing, people who have become dear colleagues in a very short space of time, and all my fellow registered nurses in this room and online today. And maybe, if you excuse me, a special acknowledgement to the other male nurses in this room and online at this time today as well. It's a pleasure to be with you. And although this is a presentation, not a workshop, I am going to ask you to do some heavy work this morning. I need your attention to stay with me as we move through thinking about the future of nursing within an evidence-based lens and perspective. And to help avoid any confusion, I want to start by giving you my conclusion. My conclusion is this: we strengthen nursing and the future of nursing by investing deeply in the primacy of practice. If years in academia have taught me anything, it's that we need to continuously invest in the primacy of practice. We are a practice-based profession, and practice is the roots of good nursing. The second part of my conclusion is simply this: nurses all around the world need to be better at using evidence in their decision making. That's it. Those are my two conclusions. So if you have no other lesson from today, hopefully you have that lesson. I'd like to thank the members of the organising committee. This is a superbly interesting and engaging program with hot topics delivered by specialists from around the globe, contributed to by leading academics and executives. It's a great program, and today is a special occasion. So thank you very much for the privilege and the honour of being with you today. I'm Craig, a nurse implementation scientist, and it is just a pleasure to be with you. So I want to start with a reflective thought. I have a question for you. What motivates you? I mean, what motivates you professionally? What drives you? What's the one thing that really moves you and unites teams and brings organisational culture together in strong ways that enable you to lead and practice nursing well? What's that one thing that is the spark for useful, for innovative, for high quality, high functioning organisations where everyone is motivated to do their part, to do their thing with utmost dedication? What is that one thing? I've been reading about this. Simon Sinek, some of you may have read some of Simon Sinek's work. Bernard Shaw, Peter Drucker, in fact, all the leading thinkers on management theory and people leadership say the same thing. Knowing your organisational why. So going deeper than do, going into why, is the most powerful knowledge that an organisation can have. They argue that why, that one word, why, defines the motive for improvement and growth. It's not just about money. It's not just about status. It's about improvement and growth. And why? Where does that word come from? The answer to that word comes from our vision and our purpose. Each one of us in this room and online today has a vision and purpose for becoming a nurse. Why? That's the driver, that's the spark for our internal and our organisational engines. Why is important? Today I want to do something tricky with you and try to connect why to how. Two small but very important words, why and how. So we want to, you do the work, you do the heavy lifting on why. That's your professional responsibility, is why. How is something that I believe JBI specialises in and makes available to the world through programs, tools and resources that go beyond why, and they answer the question, how? How can I? Or how can I enable and equip others for EBP? So that's where we want to go today with this talk. How is the implementation of why? All right? How is the implementation of why? So we want to get to that point. Before we do, I have no particular declarations. I have no direct or indirect conflicts of interests or financial incentives associated with this presentation or my time here. I'm here out of passion for nursing and because of a very kind invitation to join you, and I appreciate the privilege. So if we're going to talk about how, there are right ways we in Indonesia, there are 3 well-known marathons. Perhaps the Maybank Bali is one of the best known around Australia at least. And maybe that's a good opportunity if you're interested in getting into running and exercise. All you have to do is sign up. No preparation needed. No need to buy a pair of sneakers or any special equipment. Just sign up, turn up, and start running. Maybe in your favorite dress, maybe in your favorite jeans. And suits, it turns out, are very popular jogging apparel. And in fact, you could have done that in August at the Maybank Marathon. I wonder, did anybody run? Any runners in the room this morning? All right, 1. There's a few runners, good. All right, now, the heavy lifting I need to do this morning is for us to transition from thinking about what does preparation look like? What does preparedness look like? How do we transition from why to how? So why wear a suit to a marathon? But that question transitioning to how do we really prepare ourselves? What is common between the future of nursing and a marathon? Well, you probably already knew this, but the best way to win a marathon is not to wear a suit. It's actually to run with a team. To run as part of a team is the best way to win a marathon. Taking a team-based approach is far more effective than attempting to lead from way out in front, all by yourself, for the whole duration of a race. It's important to note. Of course, every race has its champions, and you probably recognize on screen the leader from Salonga General Hospital in Bali, who was instrumental in providing training and education to nurses during COVID-19 pandemic. She demonstrated, but didn't just demonstrate, she inculcated in her nurses strength, resilience, and longevity of impact. Saved a lot of lives. Ensured that culturally driven approaches to nursing were implemented, and her impact was maximized by having a strong, reliable team around her. So she went from why to how. If you go from why to how and you find yourself running a marathon in a suit, you've probably got the wrong how. So what's the analogy to nursing? To go from why to how is what I want to spend the rest of my talk on. This paper, which you can download for free online, is the result of a 3-year programmatic review of nursing workforce. And it used multiple lenses on behalf of what was known as the Institute of Medicine, a globally recognized and respected institution, now known as the National Academy of Medicine. And they produced this report. It's a 500+ page document, and there are sections that are particularly relevant to thinking about the future of nursing and how we are going to get there. And are we going to get there well? So those are things that we want to think about and consider. I'm going to bring a few of them to your attention. The recommendations out of this 500+ page report offer insights into what 3 years of intensive study of the nursing workforce has been able to determine will carry nursing into the future well. It's about what that workforce could look like, and it's also, when I cross-compare this report with the work of the International Council of Nurses, there is a lot of synergies between what the ICN talks about in regards to nursing and the recommendations of this particular report. So I want to look at three of the recommendations, just three recommendations out of this report with you today, this morning. And each touches on something that we talked about yesterday, for those of you that were at the workshop. We talked a little bit about something called the Sicily Statement, which is around core educational competencies for evidence-based healthcare that apply to all health professionals, not one profession, but all health professionals. It looks at it from three perspectives. So I wanted us to just take a few minutes to look at those. The first is around governance and policy, then pedagogical concepts, and then where I'll spend the last half of my talk is on the practice perspective. So if we start by thinking a bit about the leadership perspective. Nursing leadership at national and international levels has a responsibility to initiate and to build the case for the value proposition that nursing represents globally. To build that alongside healthcare policy, the policy makers and funders. So the voice of nurse leaders who know their why but can articulate the how are critical to this. We need those leaders at the table to communicate national and strategic value that represents nursing at a financial level. This is interesting. So this is a recommendation from that report. And you can see it's now an old recommendation, but has this happened? Are there substantive actions in place that enable the workforce of nursing, and look at what it says, to address social determinants of health and health equity more? The representative for the minister this morning talked specifically about equity. So we can see there is a growing trend for the policymakers who shift and move what is nursing, what are the core functions and attributes of nursing, to actually bring equity into the picture of what nursing is and does. The second interesting point is about education. By 2021, education programs, leaders, licensing boards, and organisations should initiate structures, systems, and this bit I like, evidence-based interventions to promote nurses' health and well-being. Is there a workforce that's had more challenging time over the last 5 years than nursing? The frontline carers through COVID, the frontline carers through natural disasters. Who cares for the poor and the disadvantaged day by day? It's nurses right there at the front of that. So what about your well-being? Are there mechanisms and policies in place to care for the well-being of nurses? This is a vital question for a sustainable, educated, professional workforce. And we need to know that these things are in place. So I guess I have questions, not answers. To what extent does Indonesia have integration to build capacity for nurses to drive improvement, to lead implementation science, to establish structures, systems, and evidence-based interventions that promote advanced nursing roles, and to be able to build equity? So those are really things to think about in terms of nursing. This is recommendation 4, and I'm not going through all of them, but this is a little bit about practice, isn't it? What about managing and maintaining and preparing the future workforce for scope of practice? Enable nurses to practice to the full extent of their education and training by removing the barriers that prevent them from fully addressing social needs and social determinants, improving healthcare access, quality, and value. And again, for a practice-based profession, this represents a bit of a transition in thinking to incorporate and inculcate insight and understanding into social needs, social determinants of health. Did you know as a nurse, if the right policy framework is in place, you can help improve healthcare access for rural people, for remote people, for tribal groups, for the impoverished? The only barriers really are regulation and policy. Normally barriers are a safety mechanism, right? We had the dance this morning. They put down carpet. We were asked to move back. Create a barrier between yourself and that incredible dance. Why? Safety risk with the glass. But as nurses, if we don't challenge the barriers, no one else will. We don't challenge our own barriers, no one else will do it on our behalf, right? It's up to us to do that. So when and where it's appropriate, we need to ask the question, to what extent are operational or policy-based barriers preserving value versus delaying value? You see, nurses work well to collective policy and procedure, professional regulation. We're expert at self-regulation. But this recommendation is a call to reflect on how well we are planning and considering all of those regulations and their impact on our scope of practice, our ability to implement evidence into the future. Are they an avenue to best practice, or are they an impediment? So those are useful things to think about. This is an unattributed quote, so I'm sorry I can't tell you where it comes from. But is this your sense of the value of nursing? Is this how you understand and see yourself as a nurse? Can you see your societal role? Can you see how the care you deliver links to societal needs and social determinants of health? The world is seeing us like this. The people who move global policy on nursing see us like this. They see nurses as a financial asset in society, moving practice, a professional, educated, ready workforce. So we should also be invested in thinking through these things. It isn't simply the domain of first world countries, Western-centric forms of knowledge. It's for everyone. Health systems that possess substantial resources, and Australia is one of those, have actually fallen short of expectations due to poor distribution and failure to enhance and protect health. The authors of this paper in The Lancet said, the full potential of nursing is often restricted by curtailing or restricting nurses' practicing authority. And this is the opposite of what I believe we aspire to in JBI and what you aspire to as well. Nursing is the basis of high-quality, evidence-based practice and is best when using team-based approaches and enabling clinical and academic partnerships to thrive. So how do we get there in cost-contained, restrained clinical environments? Well, if you want to be a transformative agent, we've looked a little bit at the why. Let's look at how. What we really need is cost-effective mechanisms of action, essentially. And so this is an indication of the financial value for nursing department, faculty, and clinical systems who use evidence-based audit and feedback to create change to improve safety and quality. These simply work and are cost-effective. If we're going to make a difference in this world, we have to do so in a way that's transparent and reproducible, and that enables people to follow the logic and see the science, essentially. On screen, you can see the Sicily statement. This was actually published in 2005. Yet, to be honest, even as someone who works every day in this field, we still lack reliable data on uptake in healthcare practice. So maybe today can be a new start for us. Maybe today can be a new start for you as a nurse as well, in thinking about shifting the needle forward on using evidence-based practice. Do you know how to take a problem that students come to you with or that you see and hear about and turn it into an answerable question? Do you know how to reliably, transparently, and reproducibly search literature in an expert way to find the best available evidence to answer a clinical question? Do you know how to read literature in such a way that no matter what journal it's from, you can tell whether that research is good quality or poor quality? Because good journals publish bad research. So we need to think about the quality, the validity, the clinical relevance, and the applicability of research. Of course, knowing is one thing, doing is the real challenge, isn't it? How do we apply the results of good research in practice to improve our compliance with domains of best practice? That's an ongoing huge challenge. I think every nurse of every generation should aspire to knowing how to do this. It should be fundamental to our delivery of care. But if we're going to make a change, we need to evaluate and determine that that change makes a real difference in the world. So how do we make a difference in the world as nurses? The Sicily Statement, 5 consensus points on EBP, is aligned generally with minimum recommended educational requirements that have all been built around enhancing student experiences, with the view that the next generation of leaders, having already been trained and familiar with skills and knowledge, will be the future transformation of nursing into an evidence-based professional organisation. The learning outcomes are important, and we need to consider how to best draw on those. How comes from why. So how comes from why? Application is the biggest challenge for all of us. We've seen a variety of strategies, including the 5 steps to evidence-based healthcare, that is question, search, appraise, implement, evaluate. You might be familiar with SWOT analyses, for example, clinical practice guidelines, many interventions, and the expansion of implementation science. But in spite of all of that work, change itself has been harder to achieve. The JBI model can be paired with any implementation theory, model or framework organisations are already using in order to enhance care. But it can be paired with process frameworks in particular to illustrate that connection between the core domains at a higher conceptual level of evidence-based practice, which is to respond to issues of global health by generating appropriate nursing research, nursing evidence, if you like, and then moving from that nursing evidence into synthesis, systematic reviews, scoping reviews, mixed methods reviews, qualitative syntheses, meta-analysis of the effectiveness of nursing interventions on practice. This should be the work of the academy to achieve those things, is synthesis. To move that knowledge from journals where it's pretty much useless, right? If it sits in a journal, it helps no one, it mobilizes nothing. So we academics to assist with the transfer of knowledge into domains of practice. Transfer is educational, transfer is empowering, transfer is part of our professional scope of operations. But of course, transfer itself is a little bit insufficient. We need more than transfer, we need to implement. And what we've done in JBI, and I think this could be useful to you, is to unpack implementation. So at a high level, we can conceptualize implementation around context analysis, the need for facilitation, and the requirement for evaluation to be a part of that. But that's not really how, is it? Those are what. What should I be doing? So how is what the orange model does. It is a 7-phase implementation process model that indicates what we need to do. All right, so how might you do? You could think about, here in Indonesia, what would it be like to use the JBI model with its emphasis on context analysis, facilitation and evaluation, and combine that with a process-based model, like the 7-phase model that we went through in the workshop yesterday, and bring into that the things that you already have available, like evidence implementation, clinical leadership, training opportunities, with a pragmatic emphasis on audit and feedback, the clinical application of evidence at the point of care, quality improvement bases as mechanisms to drive uptake of evidence-based healthcare, and integrated publication and active dissemination of results. So think about those as methods that you as a nurse, you may be a student right now, or you may have graduated a long time ago like I did. These are still things we can learn, pick up and run with to improve. But how do we do that? We have to mobilize knowledge. Knowledge mobilization, if you like, is the same as implementation. So how are we going to move knowledge from academia, from journals, into day-to-day practice in an evidence-based way? We have to engage and sustain and build culture and capacity, don't we? If we do lots of training, we might not get much result. So this is a study by the Australian Federal Government-funded branch for health and medical research in Australia. And it's an interesting conclusion that says programs designed for medical practitioners might not be suitable for nurses and allied health. So we have to understand and be prepared for our own educational future. So let me ask you, are we ready? Is Indonesia ready for the future of evidence-based nursing. It's partly about our research framework, but majorly it's actually about evidence-based healthcare and do we have the national systems in place to prepare for that. If we can improve these things in the way we use evidence in practice, we can improve these numbers on screen. These numbers are true today. There is too many patients that don't get reliable, safe treatment. There are too many patients that get treatment that's a complete waste of time. There are too many patients that get treatment that causes harm, not benefit. This is true of nursing care as well. So we want to transition away from that. We want evidence-based healthcare, we heard this morning, to be person-centred. So that means decisions about care made with the people who receive care, informed by explicit and tacit knowledge, so your clinical expertise and judgment as a health professional, and within the context of available resources. So what I'm arguing when I say here is the key to how, I'm saying that change is not a technique or a method. It's a person-centered process. It's not even a theory. Change is about people. Whatever you call it, it is person-centered. So a very quick example for you. This is on caring for people with delirium. There was a problem with the management of patients who have delirium in an acute care hospital. So the context was here. They used our process model to understand the context, the problem, the stakeholders needed. They established that everyone had a shared concern. All the nursing staff were struggling with how do we manage delirium. They used JBI's implementation approach to identify the barriers and then create strategies to address those barriers. And then they remeasured, they evaluated again at the end of that in order to determine, have we made a real difference and is that the right kind of difference? Good to evaluate the things we do. So that's just one example of using change mechanisms well. And this was my original conclusion, but I changed it this morning. So I want to read you what I think is the real conclusion. So can I just have your attention for the last 3 minutes, please? What do you want the future of nursing to be? The future of nursing education, of nursing research, the basis of practice. Do you want it to be evidence-based and informed with the use and respect and recognition that nursing knowledge, leadership and expertise deserves? Do you want the profession to continue to be highly regarded here and more widely? If that's the case, I think it's up to you. What would strengthen the voice of nursing at the most important tables of policy and leadership? So here's the conclusion I started with, and I want to finish with it as well. The profession of nursing is defined as a practice-based profession. Practice is our primacy. Our status in communities worldwide is one of trust. We are trusted to provide care. We're trusted with the intimacy of people's lives. We are trusted for our competence. This is our pathway to strengthening the voice of nursing at the most important tables in the world, tables that are already talking about us, is to think about, to study, to build collaboration, to integrate implementation and evidence-based practice into the care, the competence, the knowledge, the leadership, and the expertise that lives within all of us. Whether you're a first-year student or a 30-year postgrad leader now, I believe this is our call and our future. So thank you very much for your time this morning.
Okay, let's give a big round of applause for Dr. Craig that present the topics for today's morning. So the take-home messages from him that we should improve our roles in the health equity advancement by using this evidence-based healthcare and make sure that the changes that we made, it started from us. And it is really important for us as a nurse and also academics and also policymakers to make the highlight of the implementation science and knowledge to the nursing field. Thank you, Professor. So we move on to the next session. We will have our distinguished speaker also from Directorate General of Research and the Ministry of Higher Education and Technology. So right now we have already joined the speakers. Dr. Fauzan Aziman, STMN PhD. So can we connect with him right now? Okay. Let's have a good morning greetings to Dr. Fauzan. How are you, Dr. Fauzan? Can you hear me clearly? So I think we cannot hear you here. Maybe can we, sorry, Professor. Sorry, Dr. Fauzan. We cannot hear right now.
You cannot hear me?
Yes, yes, now.
You can hear me now. Thank you very
Okay.
much.
It is really glad to have you here. So we are waiting for this important session. So as you know, Dr. Fauzan is such an important person for us as he really helps in supporting research, being a researcher also, and as a policymaker for the Ministry of Education. So maybe we please Dr. Fauzan to present his topic. Please, Dr. Fauzan.
Thank you very much. First of all, my apologies for not joining in person, as today I'm attending through online from Yogyakarta. So I had an activity this morning in Yogyakarta. Hopefully I can attend University of Andalas in West Sumatra soon. But nonetheless, I really appreciate for the invitation to us. And then I would like to appreciate to the West Sumatra governor that is represented by the expert staff in the field of economy and finance, Mr. Saiful Bahri. My appreciation as well to the rector of University of Andalas, represented by the Vice Rector, Dr. Hefrizal Hendra, and also Director of RSUP, the hospital, Dr. M. Jamil and Dr. Dovi Janas, and also the Dean for the Nursing Faculty of University of Andalas, Dr. Deswita, and the Head of Research and Community Services of the university, represented by Dr. Apotheker Friday Esmet.
Recording in progress.
Of University Hospital of Andalas, represented by the Director of Services, Dr. Yose Rambe Ilhamdi. Allow me to explain a little bit about our policy, especially in how we see transforming healthcare through research. Let me share my screen, and then I'll start by a little bit of introductions of the ministry. So my name is Fauzan Aziman, Director General of R&D in the Ministry of Higher Education, Science and Technology. And we see that the nursing team and in the wider team is transformations of healthcare, something which is of high value within a country. And in fact, we are at the moment mapping the requirements of nursing and then our health professionals which we feel that a strategic approach in this is important. And then part of this is including how we improve our science and innovation contributions to the development of our human capital. So hopefully my explanations will give a little bit of background on the thinking process and also the direction towards our policy in Indonesia. Allow me to start by introducing a little bit of our ecosystem building within the country. We start from opportunities. So the opportunity side, in 2045, 65% of Indonesia's populations will be in the productive age group, which means that economic-wise, we have a sufficient inertia to hopefully we shift toward advanced country. And then we also see, on the other hand, challenge in terms of difficulty for us to improve our total factor productivity, which also means that we need to intervene and then do some strategic development of our future ecosystem. So what we do at the moment is building 4 key pillars. So the first pillar is human resource upskilling. So human resource is indeed the most important that we need to build within a country. So nursing as well, technology associated towards the nursing ecosystem, healthcare services. So these are very important to us, and then how education could be embedded within our university, industry, and also global health becoming something that we would like to focus on. And then second is with the context of innovations policy in the nursing and healthcare, we would like more and more higher quality research and development. So we understand that the quantity itself started about 4 or 5 years ago. They may start working well, but we do need to really push towards the quality side. So we are improving, for example, doing some infusion programs and then exchanges, sending, of course, our researchers and also students overseas, so on and so forth. So the idea is we are pushing towards quality. And then the third is, in English, it is not very natural, probably, but in Bahasa Indonesia, we call it hilirisasi of research. So downstreaming, which means that commercializations of our research or translations of our research becomes important, and then how this can actually be used by our community and also improve towards partnerships. So partnerships becomes key. The reason of this is because of we would like our research innovations will be part of our economic growth. So scaling up process becomes important. And then the fourth pillar is adaptive policy. So we would like our policy to be developed more and more based on data, based on science. And that will then be built through foundational approach, where we see both infrastructure, so the hardware side, and then also the technology adoption, the software side, which is sometimes we see that nowadays the development of artificial intelligence does affect a lot of sectors, including, of course, health. And then this is where we would like to build. So Indonesia's economy based on science and technology, supported by key pillars, and then hopefully we can then push forward a few strategic industries within the country, and one of which, of course, health. Now, if I delve deeper into then how do we see a relationship between what we build in Indonesia and globally? So global health and healthcare development, something which this day cannot be taken apart with our internal development within the country. For example, global health and healthcare does use digital innovations and AI connectivity, for example. Scientific advancements becomes critical. And then there's also this surge in healthcare spend investment, which means that healthcare does do return. And then we see as well alternative care models. And then on the other hand, we see as well disparities growing. And then we see as well shortage of healthcare worker, burnout, and then also mental health and well-being worsening. And there's this macroeconomic issues. So there's these two balance of global health and healthcare that we look at, and then we start positioning where Indonesia should be and then how we then need to build our policy. We also see global health trends and actions in 2025. This is a surveys by Deloitte. By all means, that this is our benchmarking process, trying to understand the impact of healthcare through transformations of digital workforce, and importantly is also patient engagement. So patient engagements become a key product of R&D, which is being very economical and also something that we look into more and more. So hopefully by developing patient engagements, technology innovations around, we can not only bridging development globally, but then bringing as well the infusions of technology from outside to Indonesia and develop Indonesia aligned to our local wisdom or development of what actually needed within the country. Now, there are a few key areas that we see action need to be done, and then aligning to WHO, especially on understanding again global patient safety challenge. We see patient engagement is key, so patients and the public, but then that comes from building ecosystem of healthcare professionals, and that needs to be done through education, teamwork, incident learning, and quality medicines development. And in fact, we also need to look into leadership, prescribing, monitoring. So this is a holistic approach in seeing our key problems, and at the same time, we need to also align this with, again, our local wisdom, the way we absorb system development within the country. So this is something that we are keen to research on about, and then something that we are keen as well to be develop continuously within the country. Now, looking at R&D impact of what we can do with R&D, I try to bring AI policy. So because this is just one angle of healthcare, of course, but perhaps this will show a better angle of how we would like to deal with it. So we would like to use AI more and more to empower human rather than the other way around. So we would like AI to also then affect our medical technology research, for example, high precision medicine, and then in nursing, it's again the patient engagement will be better and more efficient and effective. So we would like to enhance our capability of medical technology and research. So this is something where we are heading towards. Of course, there are things that we need to delve deeper along the way, especially on how do we actually research or fund our research. So funding of research for long, based on topics, national topics, important topics, we sometimes forget the most important may not necessarily be topics because of few things. First, things that need to be solved, they come in challenges, and then challenges means they need interdisciplinary. So interdisciplinary becomes a very key part of this. The reason being, for example, in health technology, you can of course bring medicine, you can always bring as well things highly relevant to the medical itself. But then surround the technology, for example, energy and also sociology and economic development of health technology itself. So they're all interdisciplinary. What we really want to do is we would like to channel data in terms so that our research focus will be based on problems or challenges. And we would like as well to link bit by bit that our economic growth will be through research-driven transformations of our ecosystem. So this is more and more commonly coined as deep tech. So deep tech is something which we would like to see more in Indonesia universities. where we develop IP, and then an IP could be licensed, and a license will be used by industry, will be by community, and that will then create wealth. So hopefully this gives you a little bit of trajectory of where we're heading. We would like our R&D in healthcare and innovation to understand well the underlying research question problems that we need to solve. So now, how do we go about that, and how that would be effective? So understanding problems or challenges, meaning that we need to listen. So listen to industry, listen to our overseas partners, listen to communities, listen to as well local government. So we are now collecting problems, and hopefully there's all high value problems from industry, government, community. And then we would like university, healthcare society, nursing society becomes problem solvers to our key challenges within the country. And then in the future, we would like to see more that our campus or higher education community as node of economic growth. So this is where we are heading. Now, we see that collaborations become key, and then interdisciplinary becomes more and more important. This is an example of collaborations, reflection, critical thinking, dealing with uncertainty. So they are all tangled between each other. And then we would like to see more complex problem solving capability, especially of course in the nursing community, so that we can be adaptive. We can also then be integrated in a way which means that hopefully that financial, for example, could be then solved through the collaborative ecosystem, which enhance our interdisciplinary way of thinking. Now, I will bring a little bit of then what kind of outputs you see, say in healthcare technology development, and also that may improve the way we run our health system. So this is just a few of R&D as an example. For example, bringing digital transformations to health, strengthen digital health standards being done in private, for example, hospitals, but we surely can improve further. So this is helpful for nursing community to reduce human error, for example. We also see that research and evidence-based nursing, for example, promoting nursing research and medication safety, reporting system, patient educations could be part of research ecosystem. And also more and more we see recently we saw as well in a few universities in Indonesia start usage of VR, virtual reality based learning for safe medication practice. So something which we could endorse to assist the education system and also precisions of our service development within the country. Now, we also bring an example. This is a product developed at University Gajah Mada, which is INOS, to detect or to screen TBC at early stage as possible by just an inhaling tool. This hopefully can assist our nursing ecosystem, healthcare ecosystem, to quickly identify or diagnose TB. TB is still one of the biggest spender from a report from the Ministry of Finance in terms of our health ecosystem spending. And we would like R&D could help really to solve a key issue in understanding the spread and also a diagnosis of TB in in an integrated manner by developing products through our university R&D ecosystem. Now, we see as well key, as I mentioned earlier. So we talk about products, we talk about the trajectory of our R&D. We would like to see as well focus on our healthcare education. This could be helped by, again, the assistance of AI. I mean, AI could be, it has two sides of coins, a threat and could be at the same time opportunity. So there is opportunity side in AI. So we see that healthcare educations may be helped by the nature of more and more personalized learning. So people can learn through a tailored experiences based on the individual learning style, pace, and comprehension levels. So hopefully this assists people to get into nursing. And then second is to bridge digital divide, because more and more resources can be accessed online, and then they can be used in a way as a private learning space. So hopefully that this can then means that we can reach remote and undeserved underserved populations across Indonesia. And then third is workforce development. So more and more our healthcare ecosystem will be getting some advantage by understanding of digital technologies. So we've been told by a community, actually a professor at Oxford University, saying that doctors, nurse may not be replaced by AI. However, doctors, nurses who do not understand or do not use AI may get replaced easier. So AI will be ubiquitous more and more, people using it as a day-to-day tool. So we would like our ecosystem as well to understand at least the use and how we can again empower us human through AI development. A few on the healthcare transformations through AI, which we could point out, for example, enhanced diagnostics, early disease detections, hopefully as well cheaper, and then also improve operational efficiency, especially in healthcare facilities. So hopefully all those technologies will assist our healthcare implementations in the country. The only thing that we need to be aware about, we do still have key challenges. We still have digital literacy gap within the country. We still need also to see ethical implications of development of healthcare technologies. We still have limitations on infrastructures. And then one very key is that we need to work on data privacy and security in a way that healthcare development still need to be captured in terms of opportunity at the same time with the development of reliable data privacy and security system within the country, which we are working on. We also try to build a few strategic plans to foster this advanced research in healthcare, and that include to invest, and then building the ecosystem of innovations, and then ethical framework at the same time need to be built. But in Indonesia, it's very important to always add the inclusive development of our technology program, human capital. It's just because our demographics. So hopefully by having a key strategic plan in terms of vertical and horizontal development will help us to then build our research and roadmap in the future. So let me bring you a little bit about our Indonesia's research map. So in the last 4 or 5 years, we have funded 66,669 basic research. So this is more on the basic research side. We do have as well on the more applied research. The idea of showing this is we are building data or evidence again based policy by really understanding where research being carried on and also the impact of research itself. So impact of research becomes important because that would maintain our research funding in the future. we also at the same time doing collections of problems and then start mapping them. So this is map of problems, and then in this case is map of stunting in Indonesia. And then as you can see that we do have disparity, we do have gaps, we do have slightly difference between few places. But then the question is then, we know differences in terms of each of our region, and then what can we do about it? And what we do is, this is an example where we map stunting research that is happening this year. And then also again, superimposed to the map of stunting itself. So we would like to just make sure that despite, of course, research can be done anywhere, but really universities close to where we have problem should do a game-changing contributions to their own society. So, which means that we start putting a little bit of strategy on where we would like research to be on. So we have programs where research could be centralized through big universities, but then we would like as well those universities to work with local universities adjacent to where problems are. So we are mapping this carefully, and then we design some of our research to be strategic. Now, we also built a roadmap, and then the one key of our roadmap is indeed in healthcare. And in the last part, I just want to explain a little bit about our funding program. So we do have just recently have launched a strategic research funding program that University of Andalas can be also, of course, part of it. And that, of course, as well, including our current good relationship with some overseas partners. So that includes a funding for international collaborations too. Let me explain a little bit about the programs of research that we are working on and we are building. So a key theme of our higher education, science and technology is to build impactful research ecosystem, which means that we build a number of research programs, but then the very basic is to build ecosystem, again, back to the first point. And then on top of the ecosystem, we build talent, research, and then technology transfer become important. But I just want to mention that the top of the pyramid of our higher education, science and technology, in fact, is community or society. So this is the reason why we listen, and then we try to then put some effort in making impact out of our R&D activities. Now, let me delve deeper into our research funding program. So there are two programs within the country. So this hopefully makes easy to understand. The first is what we call it a priority research funding program, and second is what we call it strategic research funding programs. So what is the difference? The first is priority research program. So priority research program, priority in Indonesia research still on equity. So we would like more universities involved, capacities of university research increase. So it's about bringing average success indices of research across the country, improve basically. So we are using our national budget to fund this research. And you saw earlier the map that in a year, we fund around 16,600 research, done around 2,000 universities. So we have around 3,000 universities within our ministry. And then we identify 2,000 of them are doing research. So some universities are focusing more on education side. So we still have some universities, they don't actually do or actively do research, so something that we need to improve. But apart from our ministry, there are some universities under different ministries, energy, health, and so on and so forth. So in total, we have 4,500 universities. So we spent about 2.5 trillion rupiah for this program. And then the second is something that we launched just a few weeks ago. This is our strategic research program. So the idea here is that We are strategic so that our research will be impactful. And then we put effort on a few key strategic problems. So this is again linked towards that we are collecting problems from industry, from local government, so on and so forth. And then we put then our investment in solving those problems. We bring highly more or less qualified researchers. So a strategic research program will aim able researchers, where priority research program trying to bring capacity of our researchers going higher and higher. And then once they're doing well, we will then suggest them to be competitive in the strategic research program. So the size of each program between priorities, so priority usually around 150 million rupiah per project, so it's pretty small. But then for the strategic research program could be up to 2.5 billion rupiah per year. So these are the three scheme clusters that we're building: high caliber researchers, impactful researchers, and then downstream research. And then just probably good to explain on these high caliber researchers. So this is a new program where we focus on trying to find associate professor and professor who are doing well and then in need of the development of the research group. So we could fund for one researchers up to 2.5 billion or 2,5 miliar rupiah each year. And that could be extended up to 3 years. So in total could be 2.5 billion rupiah or 2.5 million. And then we do have as well research in international collaborations. At the moment, we have co-funding programs with Australia. There are a number of programs there, Koneksi, PAIR, and some other programs. And then we have a co-funding scheme with the Netherlands. We have co-funding scheme with the UK. And then we have co-funding scheme with France. We are building more as well with other countries and also linking not only university side, but also some industrial problems. We have as well a scheme to fund product development called sandboxing. So this is to test your prototypes of output and then linking also to industry. And also do hackathon, trying to solve real problems by bringing researchers to solve and introduce them to investors. So from upstream to downstream. Now, I mentioned that for the priority research program, we secured our national budget of 2.5 trillion rupiah. And then for strategic research program, this is in collaboration with the Ministry of Finance using endowment fund of LPDP. And then the funding is around 1.1 trillion rupiah. So it is smaller, but it will be focused on strategic team and strategic research problem based on ecosystem of high caliber researchers that we aim to also be competitive internationally. Thank you very much for your time. Again, apologies that I'm joining online, but I would like to endorse more and more that international conference like this will be very useful for our Indonesia peers at the same time as well, of course, to improve our interactions, so interactions with our international speakers. So I would suggest that do develop more and in a way as well, do collaborate more so that our research output will be more and more impactful. Thank you again for your time and
Okay, give big round of applause to Dr. Fauzan. Thank you, Dr. Fauzan, the General Director of Research and Development of the Ministry Higher Education, Science and Technology of Indonesia. So it has been highlighted also by him that we need to bring the ecosystem to comes up with, and as the previous topic also concluded, the comprehensive approaches in support implementing science. So we would like to make the change in the process and also the outcomes. So I would like to open up discussion for all of the audience and also online participants. I hope you still listening and also be there. So everyone who want um, to put some opinions or question related to these topics, please just raise your hand, or online participant can tell us what is the insight that you have on your mind. Do we have anyone to ask some questions or opinions related to these topics? Okay, I think it's pretty much understood by the audience, Dr. Fauzan. So I think this session, we move on to the next session. And I am really grateful to have these two speakers for this morning session, Dr. Fauzan and also Dr. Craig. So I wish you take care there in Yogyakarta, and also thank you, Dr. Craig. So I will close this session. Thank you very much and good morning.
Terima kasih Bapak dan Ibu sekalian. Mohon izin, Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you so much for our keynote speaker, Associate Professor Craig Lockwood, RN, BN, Graduate, MNSc, PhD, and Mr. Fauzan Aziman ST, MN, PhD, from the General Directors of Research and Development of Ministry of Higher Education, Science and Technology, Indonesia. All right, ladies and gentlemen, we now proceed to plenary session 1. For our first plenary sessions, we are delighted to welcome Professor Yu Yun Su, PhD, RN, FAAN, from the National Cheng Kung University, Taiwan. Professor Su will discuss multidisciplinary research to develop a digital health system for improving health outcomes. And these sessions will be moderated by Assistant Professor Dr. Chandra Promnoy. And ladies and gentlemen, please welcome Assistant Professor Dr. Chandra Promnoy.
Yeah, I will introduce you first. Good morning, everyone. Good morning, everyone, and warm welcome to our section on multidisciplinary research to develop a digital health system for improving health outcomes. It is my honor to introduce our speaker for this section, Professor Yu Yu Chu. Professor Chu is a distinguished academic, a leader in the nursing field. He currently serves as the professor at the Department of Nursing at National Cheng Kung University in Taiwan, and is the president of Taiwan Association of Nursing Education. Professor Chu holds a PhD in nursing from University of Pittsburgh and is a fellowship of the American Academy of Nursing. Her work is perfectly aligned with our section theme, focusing on Extensively e-health and maternal and child. He has served as the principal investigator for many research funded by Taiwan Ministry of Science and Technology, exploring an innovative approach to the patient symptom management and improving health outcome. Her work, which has been recognized in many awards, directly demonstrates the power of digital health system. Today, Professor Hu will be sharing the invaluable experience on interdisciplinary research, exploring why and how of interdisciplinary research, and provided practical strategy for its successful implementations. Please join me in giving a warm welcome to Professor Yu Hun Chu. Professor Hu, stage is yours.
Hello. Okay. Good morning, everyone. Salama pagi. The chair, Dr. Yankee, and the team, the Dr. Deswita, yeah, and all the distinguished guests. Apa baka. Baba. Yeah. Thank you. Yeah, I would like to say it's my honor to present this international conference. Actually, I have many international students. Most of international students, my advice comes from Indonesia. Until now, I have taught the 9 Indonesia the students. So. Today's my topic is about the interdisciplinary research to develop a digital health system for improving health outcome. Before I present my topic, I would like to, okay, so I will just, okay. I would like to introduce my school, National Cheng Kung University, shortly. The Cheng Kung University is located in southern of Taiwan. This is why I'm come to here very happy because the Thailand, located in Thailand, the Thailand city, the atmosphere climate, temperature similar to in here. And our school is a very internalized university. We have totally 9 colleges. Each year we have almost 900 international students join our group, join the university, and they have we have a very diversity, the culture in our university. So I hope it's possible in future you can join us. Oh? Okay, this is my outlines. The outline is today's my outline. Well, first I will introduce what is the interdisciplinary research, what is the multiple disciplinary research. Then after that, I will talk about the journey in the e-health, especially in maternal child nursing. After that, I will give a conclusion how to develop the just multiple disciplinary research. Here I have a question would I ask you. Are you still working on individual research? Are you? Oh. Yes? Yes. Oh, your answer is yes. Yeah. I would like to give you advice. You probably consider expand your study working with others. Then I will tell you why you need to expand your research with others and to create astonishing outcomes. Okay. I remember in 2015, the journal Nature, they have cover page here. It's very attractive to me. The cover page of this journal talk about you need to consider the interdisciplinary the research because currently our society faces several challenges, especially energy, water, climate, food. Okay, food and health. I thought the previous speaker, they talk about there are the variety of change in our ecosystem. So this is why we need the multiple discipline, the research to resolve the problems comes from energy, water, climate, and healthcare. This is the why we need to do the multiple disciplinary research. First, we would like to resolve a real-world problem. Think about your environment, your surrounding. What is the problem you encounter? Okay, problem is workforce. Problem is the elderly problem, the long-term care. Okay, and otherwise. Now the society faces a very complex problem, the complexity of science and technology. And so we need to interdisciplinary research. The third, the interdisciplinary research can provide a different perspective on a problem. And also we need the research to create a comprehensive perspective, theory-based hypothesis for research. And we can develop the consensus, clinical definition, and guideline for complex disease and condition. The final, we need the interdisciplinary research to provide a comprehensive service such as healthcare and health education. And this is especially for nursing care, why we need our colleagues or the healthcare researchers. We need the interdisciplinary collaboration competency because currently increasing the complexity and rapid change in healthcare system. Also, the nursing profession is needed to develop problem-solving abilities through the interdisciplinary collaboration. And the final, we expect nurses to collaboration and the communication across diversity team. Probably you are just curious why I talk about interdisciplinary research, now talk about multiple disciplinary research. Actually, the topic the conference the conference committee give me is the multiple disciplinary research. But after I just submitted the PPT to here, I decided I use the term interdisciplinary research. Now here I will just explain why. Then probably today you will use another term, interdisciplinary research, instead of just multiple disciplinary research. Here is 3 terms. Okay, the first term is multiple disciplinary research. Second is interdisciplinary research. Third is transdisciplinary research. Do you think they are the same or different? Actually, these 3 terms, someone will use it interchangeably. But actually, there are little differences among these 3 terms. Okay, I will explain it. The first term is talk about the multiple disciplinary. Actually, multiple disciplinary narratives talk about they have the problems and we needed to resolve it. But the circle instead represent each discipline. The discipline provide their individual solution approach to the problem or the solution, but they never interact. or few interaction. Okay, and they just provide their respect approach, and this the interdisciplinarity. Okay, we have a problem here, but the discipline interact and to discuss the new strategy or new framework to try to resolve the problem. Okay, and transdisciplinarity is they still encounter a problem, but first the disciplinary, they are not urged to propose their individual solution. They just sit there and discuss and find the framework together. And after that, they based on the new created working the framework, they will think about the solution. Then they will try to resolve the problem. Oh, here. Okay, so next I will talk about just a strategy for the interdisciplinary research. The strategy in here is the first one is you need to, just establish an interdisciplinary culture. Yes, just you say you just still working individual research. So in your institute or your school, you need to just inherent the value of interdisciplinary approach to everyone, and how to do the how to establish the interdisciplinary culture. Maybe you need advocacy, and or you need an award or give some honor. For example, my school, they will grant the faculty comes from different college and background. They initiate a project, then they will give you the money to support you run the project. The second strategy is the research course. Usually the interdisciplinary research will focus on the cutting edge area. For example, the disaster care. Disaster care is not just only to deal with the natural disaster. Sometimes you need to know how to settle down the people, just the environment, just the disaster environment, or how to just help just the survival from disasters, just emotion and health care. Okay. Otherwise, the third strategy, we need a training program to train train the people that are interested in interdisciplinary research, include the graduate courses or seminar, or we need the supportive experience. Okay. The strategy also include the mentorship. The mentorship, we probably have a very strong mentorship, and they have experience, then they can support the researchers. They would like to conduct the multiple disciplinary research. Also, we have to support the infrastructure, such as need to have just the lab, or the setting, or the resources, even the money. Okay. And also that we need a cross-institutional linkage. The linkage not only the focus on inner just the university. Sometimes we need to find the outside of the institute or campus, and we need to find a partner, and we have set an appointment to discuss. Here is the steps of healthcare interdisciplinary. There are 7 steps. First step, need to identify, research the problem. We need to define healthcare the issues require multiple disciplines such cancer, rehabilitation, telehealth, patient safety. And also you need to set up a measurable the outcome. It means how to assess success. For example, a clearly stated the interdisciplinary research question and rationale. The second step is build interdisciplinary team. This is very important. You need to find the different disciplinary, the backgrounds, the researchers comes from your university or outside of your university. So you can, you can recruit the expert from nursing, medicine, engineering, social science, and later I will share my experience how I just built my research team. And third is the develop the shared concept, the framework. Just I mentioned before, because the multiple or the interdisciplinary research team, we usually want to resolve a problem. So we needed to integrate the theory or models from each disciplinary, then create a new one. Okay. The fourth step is the design mixed method studies. We need to combine either the quantitative and qualitative approaches that suit to the already proposed research question. And fifth step is collect and integrate data. Gather the clinical data or behavioral data or technological data collaboratively. The sixth step is jointly interpret findings. We needed to conduct interdisciplinary analysis and the synthesis discussion. Step 7 is we need to disseminate the outcome, share the result across academic and applied platforms, such as you can just disseminate to the journals or any workshop or conference. The final step is to evaluate and reflection. We need to assess collaboration process, integration level, and the overall project, the impact. The ways to create interdisciplinary research, there are two ways. You can top down or bottom up. The top down means, okay, now the government or your institute announce they would call for the research. So you're probably searching for the multiple backgrounds, faculties or researchers to build up a team. Then you apply this just the grant. Okay, so this is top down because you would like to apply a research grant. The bottom up means that you already have the team there, and the team probably comes from your one course or comes from your institute. You already have a team there. Then you're looking for any possibility for the grant for the interdisciplinary research. Actually, they have some the competence of interdisciplinary research. The competence include you need to depth of knowledge in one discipline or field of study. Once I attended a multiple discipline research team, someone told me, oh, Professor Xu, because I help them to just tie something, then the other team say, oh, you have very good skill in find the skill, and also I have the knowledge to take care of people. So it's the depth of knowledge. And also you need to have the ability to recognize the strength or weakness of multiple disciplinary. What is the strength? You can resolve the complex the problem, but the weakness is, until now, the most weakness of multiple discipline is when you want to initiate a team, the conference, you need to wait more than 2 weeks, not only 1 week. Then you can set up a time. It's very difficult to recruit everyone together. The third ability is you need to apply the approaches and tools from multiple disciplines to address a research the problem, also include the ability to work in a team with the individual trained in different disciplines. So the team is very important. When you want to find someone to be your research team, you need to think you need to have ability of teamwork. Also need the ability to communicate research based on the discipline or field of study to academic researchers trained in different disciplines. The final competency is the ability to communicate about the interdisciplinary research to both the general and the non-academic audience. This is a study conducted by the National Science Foundation in US. They conduct just integrated graduate education and research traineeship. Based on the traineeship, they do a survey. What's different between the PI, just a principal investigator, and trainees about the, I mentioned before, the competence of interdisciplinary research. So the results showed in here, there are just two items are different. First item is the depth of the knowledge in one discipline or field. The PI has more agreement than the trainee, And on the other side, the item ability to communicate about interdisciplinary research to non-academic the audience. The training is more the agreement than the PI say this is most important. So, following, I'm going to share my journey in interdisciplinary research. Just, my background is maternal child nursing. So my first journey in the e-health for the multiple disciplinary research is in maternal child nursing. So first, I would like to thank you the research team. At the research team, we have built up in the 2013. At the later time, how can I build up the research team? Actually, I would say that this is the professor, all this one is Professor Ho. I think when I finished my PhD study from US, the schools would let me just in charge course, informatics and healthcare. Do you know at the later time, 2005, I want to recruit a graduate student to join that class. Unfortunately, every year, just only the 2 or 3 students they would like to join. Because that time they don't know what is the purpose for the informatics in healthcare. Then I just in charge of this open the course every 2 years. Then every year just only 2 or 3 students join us. I thought in starting from the 2018, every year I needed to open the course, just in charge of this course, because more than 2-3 is every year we have 10 to 12 graduate students that would like to join this class. So you can see there is the trend in health, applied e-health in the healthcare. Okay, so let the Dr. Hosh, that time I invite him join my course team. We teach called, he helped me to organize some of the courses. And so, and included his PhD student and my just master and PhD student. So the course we would like to apply e-health in maternal child health and to improve the quality of life among the perinatal women. This is also the aims of this team. From the 2013 to the 2025, we have 5 projects from this team. Okay, these 5 projects include a web-based antenatal care system, the internet-based application app to maintain ideal weight during the pregnancy, breathing app for improving childbirth satisfaction and relieving labor pain. And fourth is e-health management for women with the high-risk pregnancy. And final is edema assessment system. The first one we call the Preg Front Care, a web-based antenatal care system. You see the, can you guess how old of this the cell phone? Okay. How old? Should be the 50 years old. Yeah, 50 years ago. I remember why I created this system, because of the 2012, I applied a project, small project, from the nursing association. I said I would like to create the APP. Not that time is not the APP. We would like to create the system to just do the antenatal care. So I got the funding, and I invited my student and Professor Ho join together to create. And that time just I applied this system into the Android cell phone, not the Apple. Because that time the Apple cell phone is unpopular in Taiwan, okay? But now it's very popular. So our team will create the APP, okay? So this is the features of the APP. Probably this time it's not, you think it's not a very new, but at that time it's very new. We include a web-based maternity record and prenatal health education information and self-care journey, and they can do the baby birth record. So every time when the woman log in this system, then we can estimate the age of pregnancy. And based on the age of pregnancy, the system will jump up automatically what the information they need. Okay, so this why is attract the women that would like to join this study. So this is the evaluation of this the e-health project. We evaluate their pregnancy stress and the general self-efficacy before they enroll the program. It means that they use the APP, and also after. So here you can see both the pregnancy, the stress, and the general efficacy, self-efficacy is significant. We compare the pre and after. That after is 1 month, and it's just post. Okay, we collect data at the 16 to 24 weeks of the age of pregnancy. The poster test was conducted as the final the weeks, almost the final the months. Yeah. So there is significant decrease in pregnant stress, but increase the general self-efficacy. And here is the evaluation for the users, their satisfactions about this antenatal care system. As you see, there are up to the 95% of users, they say they will recommend this app to other the users, other women. And they also say if they get a pregnancy next time, they would like to continue use this app. But just the 80% they still saw that this app can help to pregnancy. Okay. The second the app is for management of body weight and nutrition intake during pregnancy. Here is this one is the app is very simple because we just based on a concept that keep the idea the body weight is important to women avoid they become a high risk pregnancy. So we just give the we ask pregnant women to key in there the pre-pregnancy, the body weight and height. Then we can calculate there the BMI. Then based on the BMI, we will estimate ideal the body weight gain during the pregnancy. So every woman they have their the individual the recommendation for the ideal body again. And also, every time they check their body weight, they will key in. They will base them. The app will, will illustrate the line chart for a range of ideal weight. So they will just your body weight this time is out of range. So please, you need to pay attention your body weight. Okay, and this one we also create a friendly interface to estimate food calorie of intake. So the users will have photo for their food, any kind of food, then upload to the website. Then we will say, how much calorie you take this time. We also do the evaluation for users' satisfaction. Actually, we use a 1 to 5 score. Totally 52 pregnant women evaluate this app. The most satisfied is the weight cup, but less satisfied is in the interface. At that time, it's not very friendly, and also they thought that the calorie estimation is not the accuracy. Okay. How fun I still have. Okay, and third one is breathing self-paced application. And here is we create just a app for just practice the breathing exercise. Okay, so we have 4 the features. The first one is breathing direction, how to do. And we also have video provide a woman they can learn it. Then they have self-learning mode, feedback curve. I will introduce later. And also can do the record all the history they practice. Okay. Here is the interface of this app. As you see, they have breathing the patterns for women they can practice during their pregnancy. Deep and slow and swallow and quick breathing. The woman they will follow this pattern to practice. Then the green box will show what they practice the pattern in here. So this is provided the feedback for them can improve their breathing practice. Then after that, they can practice their breathing pattern during the labor. This is evaluation for the breathing app. We use the childbirth self-efficacy scale to women after they deliver baby, and they have significant in these two groups, experimental group and control group, in outcome expectation and efficacy expectations. And also is they will be very satisfied in self-control in labor pain. This is user certification. So they are most satisfied in practicing in the information, but they think that there is the lag in when they want to do the self-paced practice in breathing. The first just e-health is for the woman with a high-risk pregnancy. This one is specially designed for high-risk pregnancy women, especially they have the pregnancy related to the hypertension. So we just based on before our experience, we create a just system that can monitor the client condition, and also we create a case manager system. So the left side, only left 5 minutes. Okay, okay. The left side is we have some information that if they want to have the question, they can click, and they can leave their message, and they just the nurse case manager, they can just answer the question immediately or next day. Because I only have left 5 minutes, so I will go quickly to see another one. Okay, the final, interdisciplinary in e-health is the remote just edema assessment. This idea comes from COVID-19 periods because several of the patients, include the pregnant women, they cannot go to the hospital to visit the doctor. But the edema is the symptom just for the pregnant woman or the patient that have the heart disease or kidney disease. So I and my team, we created this one, and we use the cell phone to record, and 100 patients, their PD edema, and we calculate their rebounding the process from PD status to flat skin. Then we use the deep learning skill to run algorithm to calculate the rebounding time and dedicate the edema the levels. Final, this skill get the patent certification for 20 years. And so left 3 minutes, the time limitation. I will share the education for interdisciplinary education. I use just the design thinking to create two courses involve the multiple disciplinary the idea into to help students they can create the APP how to take care of the mother and child to improve the parental skills. Okay, and also I work with the just the faculties comes from the architectures. We would like to have the just a healthy the environment, the comfort, the working environment for nurses. So this is the 2 years per project, action project. So then this is the action project. Okay. Is the we have the teamwork. Each team contains the nurse, the student, also the architecture, the department student. Then each team go to the different units, hospital to observe the just the environment, especially for nurse, the rest just their lunch room. And after that, they will discuss and to create prototype in what they would like to be the working environment in the future. So this is their outcome. Because time limitation, so I cannot present what is the outcome. So I would like to do the conclusion is the when you want to run the just interdisciplinary, you need to have a team, just I mentioned that before. And also you need to have a team, just you need a clearly goal and team leader and good communication, and especially you need institutional support. And also there are some barriers you need to avoid is the not clearly the goal and just you lack of proper the measure to evaluate success of the interdisciplinary work. And also they have several the team conflict, lack of communication between the disciplinaries, and usually unequal the power among the members. Okay. The final slide I would like to share with each other, include me, share you and include me. I say in Chinese we usually say, I say Chinese first. 一个人可以走很快 ，but 一群人可以走很远。It say in English, if you want to go fast, go alone. But if you want to go far, go together. So thank you very much.
Okay. Thank you very much, Professor Chu, for very insightful sessions that what you present to us here. It shows the power of interdisciplinary research in about collaboration to achieve for the healthcare outcomes. And since our time is run out, so the professor should still be here with us, so we can discuss further, maybe during the lunch time or maybe during the evening times. So what the professor first to provide us with valuable information how to conduct the healthcare multidisciplinary research, and she showed us how to break down the silo into improve and create healthcare system and truly improve the outcomes. She present to us is many masterpieces that show us are very powerful. So thank you very much, Professor Chu. Please Let's give Professor Chu another round of applause. And thank you everyone for the audience in the room here and also from the online. I hope you find a section as insight that as I did today and enjoy the rest of the conference. Thank you very much. สวัสดีค่ะ
Thank you, Professor Yu Yun Su, for highlighting the critical roles of multidisciplinaries and digital approaches in healthcare. And ladies and gentlemen, we have the certificate sessions given by the deans of the faculties of nursing of Universitas Andalas to our speakers and moderators, and followed by a photo sessions. And we invite the moderators and our speakers to come up to in front of the stage. For the moderator, NS Mahathir MCAP SPCOM, and Assistant Professor Dr. Chandra Promnoy, and our speakers, Associate Professor Greg Lockwood and Professor Yu Yun Suk, to come up to in front of the stage for certificate session. All right, in front of the stage. All right, first, we'll give him to our speakers. First, for Associate Professor Craig Lockwood. All right, next to our next speakers, Professor Yu Yun Shu. Oh, we have the plagues. All right. Okay. All right. Next, we move to our next speakers, Professor Yu Yun Shu. All right, next we move to moderator and as Mahathir MCAP SPCOM. Next to our next moderator, Assistant Professor Dr. Chandra Promnoy. Next, we have a photo session for all speakers and all moderators with the Dean of Faculties of Nursing. All right, formal one. 1, 2, 3. 1, 2, 3. Okay, UNAND sign maybe? You have UNAND sign? All right, 1, 2, 3. 1, 2, 3. All right, thank you so much to our speakers and moderators and also Dean of the Faculties of Humanities, and please be seated. All right, ladies, distinguished guests, ladies and gentlemen, and distinguished delegates, it is now time for the lunch break. And we already provide the lunch break behind everyone. And please enjoy your meal, and we look forward to see you back in promptly for our symposia. And have a great lunch breaks, everyone. All right, we have another photo sessions. We invite our speakers, our co-host from Universitas Gajah Mada and Universitas Alifah Padang, and with the Deans of Faculty of Nursing of Universitas Andalas to take a photo sessions in front of the stage. We have additional photo sessions, right? We invite the co-host, Universitas Gajah Mada representative, and also Universitas Alifah Padang representative to come up to in front of the stage, and also the speakers for our international conference. Alright, untuk selanjutnya nanti foto bersama dengan bersama seluruh panitia. Jadi kepada Bapak Ibu panitia juga disilakan untuk bersiap-siap karena nanti setelah ini kita langsung bergantian untuk sesi foto bersama setelah ini. Jadi setelah ini sesi foto bersama seluruh panitia. Jadi kepada seluruh panitia diharapkan sudah bersiap-siap di depan karena kita akan lanjut ke sesi foto kita selanjutnya setelah ini. Alright, formal. 1, 2, 3. Again, 1, 2, 3. Maybe UNAND sign first. UNAND sign first. 1, 2, 3. 1, 2, 3. Or we have a freestyle. We want this more happiest. Alright, show the happiest smile, everyone. 1, 2, 3. All right. Now we invite all the committees of the 5th Andalas International Nursing Conference to photo sessions. Jadi kepada Bapak dan Ibu, kepada panitia the 5th Andalas International Nursing Conference, kita akan lanjut ke foto bersama. Kepada Bapak dan Ibu dipersilakan untuk ke depan untuk mengambil tempat. Because we have a photo sessions with our speakers and the deans of faculties of nursing of Universitas Andalas. Once again, to all committees of the 5th Andalas International Nursing Conference, we have a photo session. So make sure everyone are ready on the frame in front of the stage. All right. Make sure your outfit already outstanding and make sure your face already show your best smile because this is the perfect momentum for us to take a picture, to make a moment with a special one. All right. Okay, formal one. All right, in my countdown, 1, 2, 3. Again, 1, 2, 3. UNAND sign. UNAND sign first. UNAND sign 1, 2, 3, 1, 2, 3. Freestyle, show your happiest face. Right? 1, 2, 3. 1, 2, 3. All right, thank you so much to all the committees and the speakers and also the deans of faculties of faculties of nursing of Universitas Andalas. And we also inform you all, right now we have in the lunch break times, and we will back again in 1:30 p.m. for the symposium sessions with 2 oral sessions included in the symposiums. Jadi kepada Bapak dan Ibu, setelah ini kita memasuki waktu makan siang. Jadi kepada Bapak dan Ibu dapat menikmati makan siang yang telah kita sediakan di bagian belakang ballroom kita. Dan kita akan kembali lagi pada pukul 1.30 untuk sesi simposium dengan 2 oral presentation yang nantinya kita akan jelaskan lebih lanjut setelah makan siang. Terima kasih Bapak dan Ibu, selamat makan siang.